The diaphragm, anatomy, function, and clinical relevance. A journey into the diaphragm. Hey everyone, welcome back to the Everything Surgery podcast. Today we're diving deep, literally, into one of the most fascinating muscles in your body, the diaphragm. Whether you're a med student, a curious health nut, or just a fan of knowing what's going on inside your own body, this is the episode for you. So, picture this. The diaphragm is this dome-shaped muscle and tendon powerhouse that sits smack dab between your chest and your belly, kind of like a muscular barrier between your thorax and abdomen. It's not just any muscle, it's actually your main muscle for breathing. Let's break it down. Anatomy and structure. First off, what's the diaphragm made of? Imagine a parachute. The edges, or the muscular parts, are attached to different spots in your body. The sternal part comes from your xiphoid process. That's the little bit at the bottom of your sternum. The costal part hooks onto the insides of your lower 6 ribs and their cartilages. The lumbar part? That one's special. It attaches to your lumbar vertebrae using these things called crura, plus the medial and lateral arcuate ligaments. Oh, and get this. The right crus is bigger and longer than the left, and they both have their own unique connections. At the center of it all is the central tendon. Think of it as the hub where all the muscle fibers meet. Above that, it's fused with the fibrous pericardium, which wraps around your heart. Openings and passages. The diaphragm isn't a solid wall. It's more like a border crossing, with 3 major openings where important things pass through. Caval opening, T8, that's where your inferior vena cava, the big vein bringing blood back to your heart, and some right phrenic nerve branches go through. Esophageal hiatus, T10, as you can guess, that's for the esophagus. It also lets the vagal trunks and some blood vessels pass by. Aortic hiatus, T12, here's where your aorta, thoracic duct, and those azygous veins make their move. Fun fact, this isn't technically in the diaphragm, but just behind it. Plus, there are smaller passages, like the sternocostal triangles, foramina of Morgani, Bachdaleck's triangles, potential weak spots, and little gaps for nerves and vessels. Sometimes these weak spots can be trouble, but we'll get to that in a sec. What does the diaphragm do? Alright, so why do we care about the diaphragm? When you breathe in, your diaphragm contracts and flattens, creating more space in your chest so air rushes into your lungs. When you breathe out, it relaxes back into that dome shape, squeezing air out. It's also helpful for things like pooping, vomiting, and even childbirth by boosting abdominal pressure. And, of course, it's the wall that keeps your thoracic and abdominal organs in their proper places. How does it develop? Let's nerd out for a second. The diaphragm actually forms from 4 different embryological sources. The septum transversum becomes the central tendon. The pleuroperitoneal membranes, these close off gaps so you don't get hernias. Usually, the dorsal mesentery of the esophagus forms the crura. The body wall mesoderm becomes the muscular edges. It's mainly controlled by the phrenic nerve coming from C3, C5. So if you've heard the phrase C3, 4, 5 keep the diaphragm alive, now you know why. The blood supply comes from arteries above and below. Pericardiac phrenic and musculophrenic from the top, and the inferior phrenic from the bottom. Clinical relevance. When things go wrong. Okay, time for some real-life drama. Sometimes, defects or injuries mess with the diaphragm. Congenital diaphragmatic hernia, CDH. These can happen if the diaphragm doesn't form properly. Bachdaleck hernias are the most common, showing up on the left side, while Morgani hernias are rarer and near the front. Hiccups. Ever wonder why you get them? It's often the phrenic or vagus nerves getting irritated, causing little spasms in the diaphragm. Diaphragmatic paralysis. It can be one-sided, maybe from nerve injury or lung cancer, or affect both sides, like after a high spinal cord injury, making breathing much harder. So, to sum it up, the diaphragm is your body's unsung hero for breathing, pressure control, and keeping everything in the right place. Next time you breathe in, give your diaphragm a little mental applause. If you enjoyed this deep dive, don't forget to like, subscribe, and let us know in the comments what body part you want us to explore next. Thanks for tuning in.